Fellow Guyanese, good afternoon. Thank you for joining me for today's update on COVID-19 in Guyana. As of yesterday, 375 persons have been tested, of which 305 tested negative. The total number of confirmed cases of COVID-19 is 70, and the deaths remain at 7. The recovered cases are at 12, and we are very happy for those persons. 17 persons are in institutional quarantine and 51 in isolation. There are 5 persons in our COVID-19 ICU. Of the 70 positive COVID-19 cases, 66 persons contracted the virus right here in Guyana. For the period under review, 23 persons were admitted to our COVID-19 ICU. Of the 23 persons, 12 improved and have been removed to a step-down facility. 5 deaths have occurred in our COVID ICU, and 1 person so far has recovered, and we're very, very happy. Now for the global report. According to WHO, there are 2,471,136 confirmed cases with 169,006 deaths. In the region of the Americas, the number of confirmed cases is 925,291 with 44,775 deaths. We continue to have the challenges with underreporting from persons who have been in contact with a COVID-19 case, mainly due to the associated stigma. I assure you, my fellow Guyanese, this attitude will take us nowhere except to add to our death toll. Guyanese, my dear Guyanese, lives matter. And because of this, if we all stand together, we will stand stronger. So for those of you who are afraid of the associated stigma, I encourage you to be brave. Come forward. Help us to help you and your family stay alive. I urge you to stop taking matters into your own hands. COVID-19 is serious business. Please call the COVID-19 hotline or utilize the app. Today, I have with me Dr. Kwesi Grant, the focal point for tuberculosis and HIV of the National Tuberculosis Program in Guyana. Dr. Kwesi Grant is here to speak about the persons living with tuberculosis and how they may be affected by the COVID-19. Welcome, Dr. Grant.
Thank you, Minister. I am Dr. Kwesi Grant, TB-HIV focal point at the National TB Program. For those of you diagnosed with tuberculosis, this message is especially for you. We want you to know that you are at increased risk of developing the most complicated form of COVID-19. If you become infected, you may require ICU care, and there is a possibility of you dying. Why? As you are aware, TB is an opportunistic disease, which simply means that it attacks those persons whose immune system is already weak. So your chances of becoming infected with this virus is much higher. If you are affected by both diseases, your immune system will not produce the full response needed to fight. TB mainly affects the lungs. So does COVID-19. And because of this, your lungs will not be able to survive this attack. So, we are advising that if you have TB, it is important to take your medication daily, as advised by the outreach worker. Also, it is vital that you stay home and avoid contact with persons. Your room should be well ventilated, so open the windows and use your fan pointing it towards the window. For you, it is a must that you wear a mask even while at home, especially if you live with others. A balanced diet will assist you with full recovery, so make it a priority. Hand hygiene and cough etiquette are for you as well, so make it a practice. I do hope that the information provided today was useful. Remember, TB is treatable and can be cured. Help us to keep you alive.
Thank you, Dr. Grant, for sharing this valuable information. According to Dr. Tedros, Director General of the World Health Organization, there are worrying upward trends in Central and South America, even though the numbers are relatively low. He further emphasized this, and this is what he said: make no mistake, we have a long way to go. This virus will be with us for a long time. End of quote. Guyana, like the other countries, are now strengthening the response by putting medium and long-term measures in place. I beg of you, please utilize our services. Your health and wellness are very important. Our healthcare workers are doing their utmost best, at risk to themselves, in an effort to protect you and me. So come on, don't be irresponsible, complacent, and selfish. Follow the guidelines and just stay home. Our safety is in your hands. Remember always to wash hands, practice cough etiquette, and avoid touching your eyes, nose, and mouth. And remember, the only vaccine and medication for COVID-19 is social distancing. God bless you all. Stay home, stay safe, and let us save lives.